is taking on the fight with limited staff, including nurses. Valene Petit is a host and a nurse with more than 20 years experience and joins us now with insight into why nurses are leaving their roles. Thank you for being with us, and thank you for the most amazing work that you do. Nurses have truly been the heroes during this pandemic. Tell us a little bit about the sort of impact that COVID-19 has had on the staff, and what are they going through?
Uh, this pandemic has had a stressful, very stressful impact on nurses. We're giving up a lot from our families to having to travel, losing our staff, losing our patients. It's really stressful.
Yes, I just think of the sort of emotional toll. It literally is like being on the front lines, especially in the early stages of the pandemic, of a war zone. How has it sort of changed the way that health officials and nurses feel about the job that they're taking on?
Well, nurses, we come in fighting for life. We understand. We took that vow. We took that vow to fight for life. So we're placed. It's placed before us, and we must fight continuously. It is like a battle, and it takes each one of us working together to make it happen and to bring life
Yeah,
and to maintain life.
it's definitely a calling. I think you have to be a very special person to go into this field, especially knowing what we know now, as a society, having dealt with our first in modern times pandemic like COVID-19 and what it really means to be a nurse and on the front lines. What are you hearing in terms of nurses and vaccination requirements? We're hearing cases, and this is not the mainstream, it's not the norm, but we are hearing cases here and there about some nurses maybe refusing to get the vaccine. What's behind that?
Well, many nurses have that I've worked with. Many nurses have refused to get the vaccine. And it's because we run out, and when everyone else is running away, we're running too. When everyone else was afraid and running away and what we're considering hiding, we had to face it. We had to face to save lives. We had to face, we were in there. We were dealing with not only this disease, but we were dealing with COVID-19, and we made it. All of our patients didn't make it, but we made it through. And some people feel like I've been there. I've been there on the line. They had plastic coverings on their feet for shoe covers, but we made it through. So, we already did it. So they're wondering why they have to have why it's wanting to be required for them to have the vaccine. And for understanding and listening to those nurses, I understand their decision.
You do, you understand. I mean, if someone's on the fence, what's your message to them as a healthcare provider?
As the healthcare provider, I would say that you have to make a very knowledgeable decision. You have to make that decision. But you also have to remember that you have to protect your patients, and you have to protect your family, because you have to go home to family after you worked here. So I think that it's very, very individual, and some people have been in there doing CPR on COVID-19 patients for more than a year. So, and taking care of them more than a year. So, what I just, whatever you decide, I stand with that.
Hmm. Well, I want to say, the nurses have done extraordinary work during this unprecedented and most challenging time. So what can we do, just the everyday person, to encourage nurses to stay on the job?
Well, I think that people should wear their mask. I'm glad you're getting vaccinated. Those people that are choosing to be vaccinated, wear your mask. But I don't know that there's much that people can, that the public can do to keep. Can I give you an example of what I went through one night?
Please, yes.
One night One night we had a patient and she was um, coded. So we had to do CPR for 45 minutes. 45 minutes we doing CPR on this lady, waiting for an emergency unit to come because I was in a long-term care and we had to get her to acute. So we did CPR for 45 minutes. When they came in, they did helped us and we did for 20 minutes. Yet this patient didn't make it. And probably because it could have been, we don't know, when it's somebody's time to die, we can't judge that. But we've been through some very stressful times. We've been through some very stressful times. And I think a rest may be good.
Well, I think one thing that we can do for sure is just let you know how much we appreciate you and let all the nurses out there know how extraordinary they are and how much we appreciate all that they do for us. And we appreciate you. Thank you for being with us here on BNC Live. Coming up on In the Black, your bill for flood insurance may be dropping like a stone. The new rules that could mean savings for a lot of Black and brown homeowners. That story when BNC Live continues. And here is a look at some of the HBCUs celebrating homecoming this weekend. Alabama A&M, Albany State, Alcorn State, Bethune-Cookman University, Hampton University, Kentucky State University, Livingstone College, Lincoln University in PA, Lincoln University of Missouri, Miles College, Virginia Union University, and good luck to all of those schools. We hope that you have a fabulous homecoming and a safe one.
Closed captioning brought to you by Nutrisystem. Lose weight and get healthy with meals delivered to your door.
Introducing the all-new Nutrisystem.
Now with a breakthrough drink mix that will burn body fat and help you stay hydrated. Order your Nutrisystem plan and get the fat burner free.
We've all been there. All of a sudden, your check engine light comes on. Insurance covers your vehicle from accidents, but did you know it doesn't cover expensive breakdowns? If your manufacturer's warranty is expired or is about to run out, you'll be on the hook for unexpected repairs. A broken AC unit costs over $1,800, transmission over $3,000, and an engine over $4,000. Breakdowns used to mean paying thousands out of pocket, until now.
As a mechanic, I always recommend my customers have an auto protection plan.